Hello, my name is Bouhiba Lina,
And I'm Aguni Maria.
student at the Faculty of Pharmacy, Department of Pharmaceutical Industry at the University of Algiers One bin Youssef bin Khadda. And today we're going to help you to distinguish between the common cold and the flu.
And we'll also share tips on over-the-counter treatments to relieve your symptoms.
The common cold and the flu can seem similar, but certain symptoms clearly differentiate them. Let's start with the common cold symptoms. We have frequent sneezing, runny or stuffy nose, mild, often dry cough, mild to moderate sore throat, and little to no fever.
And for the flu symptoms, we have high fever, often above 38.5 or 101.3, sudden severe fatigue, generalized muscle aches, severe headaches, persistent dry cough. Hello, I'm not feeling well at all. I'm very tired, I have a sore throat and a bite of a cough. Do you think it's a cold or the flu?
Hello, I'm sorry to hear you're feeling unwell. Let me ask you a few questions to better understand your symptoms. Do you have a fever? If yes, do you know how high it has been?
Yes, I have a fever. It's been around 38.
Are you experiencing severe fatigue or muscle ache?
Yes, I feel extremely weak and my muscles ache all over.
Do you have a stuffy or runny nose?
Yes, my nose is very stuffy.
How long have you had these symptoms?
Started about 3 days ago.
Thank you. Based on your symptoms, it sounds like you may have the flu. Take paracetamol to reduce fever and relieve muscle ache, and use decongestant to help with your stuffy nose. If your symptoms persist or worsen, please consult a doctor.
Thank you.
You're welcome. Take care and feel better soon.
Let's now move on to advice on over-the-counter OTC medications. Which OTC treatment to choose? Solutions for the common cold. We have nasal decongestants, for example, oxymetazoline spray, and we have throat lozenges, for example, lozenges containing menthol, and we have cough syrup, for example, guaifenesin. Solutions for the flu. We have antipyretics, for example, paracetamol, and we have pain relievers for muscle aches, for example, ibuprofen, unless contraindicated, and we have cough syrup or tablets, for example, dextromethorphan for dry cough. Important recommendation. This medication helps relieve symptoms but do not cure the illness. Consult a doctor if you do not see improvement in a few days or if symptoms worsen.
Now, let's move on to when to consult a doctor and recognizing warning signs.
I've had a fever for 5 days and I'm having a lot of trouble breathing.
These symptoms are concerning and could indicate a complication such as a lung infection. I strongly recommend that you see a doctor immediately. Here are the main warning signs. We have fever persistent for more than 3 days, shortness or difficulty breathing, chest pain or tiredness, confusion or altered mental state. Now let's move to when to call emergency services. Call the emergency services immediately if you experience rapid or difficult breathing, severe chest pain, sudden confusion or mental change, and cyanosis, blue lips or fingers. Here are the good practices to adapt. Drink at least 1.5 to 2 liters of water per day to stay hydrated. Get plenty of rest, especially if you're suffering from fatigue or fever. Avoid overly fatty or spicy food and opt for soup or broth instead. Lastly, wash your hands regularly to prevent spreading germs. Finally, the common cold and the flu are distincted by their symptoms: high fever and intense fatigue for the flu, sneezing and stuffy nose for the common cold. Over-the-counter medication can relieve symptoms, but consult a doctor if you are concerned. Thank you for watching this video. Take care of yourself and see you soon for more health tips.